Добрий день, я вітаю всіх, хто приєднався до нас. Мене звуть Ольга Атаманова, і я рада вітати вас у медіа-центрі Україна сьогодні. Сьогодні наш перший...
Today we are talking about fighting the HIV infection. We also will be covering statistics and challenges and the environment where this fight is taking place, given the full-scale invasion. On the eve of the World Day for Fighting HIV, we are talking about a disease that has claimed about 40 million lives throughout the world. Today's speakers are Yaroslava Lopatina, the head of AIDS Healthcare Foundation in Ukraine, Anastasiia Kuznetsova, a specialist in infectious diseases, Liubov Kuzhovkina is representative of the youth movement Teenergizer, and a specialist on the Department of HIV Control of the Prevention of the Public Health Center for the Ministry of Health of Ukraine. We appreciate the fact that you are with us. What is the general situation, the challenges that we are facing, statistics, and the issues that we face? Yaroslava? Ladies and gentlemen, welcome, and welcome to our partners and the media representatives, our friends. We are on the eve of the World Health Day of Fighting AIDS, which is commemorated on the 1st of December. Since the first cases of this terrible disease were identified, it has been 40 years since that time. Indeed, when the disease was identified, it seemed very frightening because there were no means of fighting it. What have we seen over these 40 years? We've seen the effect of antiretroviral treatment, which allows a person to live as long as if that person was not infected with the disease. The prevention is also very effective and has proven so, including the medicines. We have developed a lot of innovative models of approaches to treatment of this disease. However, the pandemic is still with us, and the pandemic has not been overwhelmed. 40 million people are living with HIV in the world. The HIV is still one of the main reasons of death rate in many countries, including Ukraine. Unfortunately, here, HIV is still a significant factor of cause of death of people. The general issue with the HIV is that it has a long period which goes without symptoms, and a person is not aware of the fact that he or she is infected with the HIV. The challenge of the society, not only the medical personnel, but the public figures, is that we must identify HIV, people living with HIV, and start the treatment. Here, we face two global challenges. The first being is testing. Why is testing for HIV important? Testing helps us not only to identify the infection, which is important in itself, as early as it is possible to prevent the circle of the disease spreading from one person to another. The earlier we do it, the better it is for a single person as it is for the society at large. The other global issue is to retain a person who has become a retroviral treatment in the cycle of treatment. In Ukraine, we know about 150,000 people who are under medical supervision, but we should be aware that this 150,000 figure is, of course, is a challenge per se for the whole society and the medical system. These people must be treated for years, even for decades, and we must be helpful in their staying in the cycle of being treated. Thank you, Yaroslava. Olga, may I turn to you? Let us talk about the urgent statistics of the dynamics, how the disease is spreading. We understand that since the full-scale invasion, the situation cannot but have changed. What do we see now? Thank you for this opportunity to participate in this panel. This year, Ukraine commemorates the 1st of December for the third time since the Russia full-scale invasion. USAID this year has announced a slogan, choose the right path. These words focus on the point that the world must put an end to a spread of disease. This is quite an urgent issue for this country as well. And it is, the slogan is important as ever, that highlights another issue specific to Ukraine. The slogan is very urgent, not only because we want to care for every person, but because it's a challenge for the whole system. The right to public health has been identified in this country's constitution. It has also been laid down in other laws. The right to the public health protection has been fixed by such organizations as UN, the World Health Organization, and the International Labour Organization. Apart from all the challenges and the losses we are seeing and we are likely to see, Ukraine is still focused on implementation of the UNAID goal, which says that 95% of people living with HIV should be aware of their status. 95% of the people who are on the register must receive the antiretroviral therapy, and 95% of those receiving such a treatment must have a so-called virus suppression, meaning that the virus load is reaching the level of 0, which is not transmitted through sexual intercourse. Now, we have 137,000 people under medical supervision in the territories controlled by the Ukrainian government. 87 of those receive antiviral therapy. And the third figure is 95% have what I have called a virus suppression, where the HIV is not transmitted sexually. In everyday life, it means that this year, every day, we record 29 AIDS and 3 deaths caused by HIV. As for the transmission, this year, the major path is a traditional one, which amounts to 80% of those under medical supervision. Second place, first, sexual transmission of HIV. 80% among people who are under supervision when they have been recorded as the first time HIV patient. The second way is the use of narcotics. The other point is testing. This year, in the public utilities, the number of testings amounts to almost 2.5 million cases for testing for HIV, which is higher than the last year. Respectively, during this inspection for the last 10 months, almost 20,000 people have been put on record as the first time case for a person to be identified living with HIV. Now, this country has been identified as one of the countries that due to the help of the donors receiving a long-term medicine, Protertovir. This injection is done one time for 2 months. This medicine is available in this country. To conclude, I would like to state that we will continue fighting the HIV, consolidating by all our efforts, by the government, by our partners, by medical personnel, and thus giving the right for people to live. Every patient is entitled to receiving life-saving medicines and for the therapy, and they're entitled to being cared for. This country will also fight for its independence and for the upcoming peace. Anastasia, as an infectious worker, you're working in Kharkiv. We know the situation over there. It's so close to the area of hostilities. What has changed over there? What do you see? Are people turning to you, the HIV positive? Are they addressing you to receive help or aid? And what is the dynamics of these turnings to you? Thank you for allowing me to join this panel. As for the Kharkiv region, since the full-scale invasion, the situation, logistically speaking, was very complex. But due to the efforts of the public public health center, and donors and partners, we have provided a timely retroviral help to different layers of people. We seem to be over the critical point. Currently, I'm working in a private public utility caring for the family health care, and we provide treatment for HIV-positive people. I would like to stress that because we've seen the better and more efficient testing due to the fast tests, and it takes about 50-20 minutes for a person to identify as a HIV positive and thus immediately receiving antiretroviral treatment. I believe that there are a lot of people in my area because it is related to what you have described as a city near the hostility area. As for our public health utility, over April, we tested 399. Out of those tested, 41 were identified as HIV positive, and they received treatment just on that day. The prevention is another area. Today, we have 36 persons receiving the so-called pre-contact prevention. As for the stigma of this disease, it's useful when a person visits his or her therapist or a family doctor. Services that are available, we have a therapist, people who are not following the track of the disease of this or that person. But we want these people to know that there is nothing stigmatic. You should not be afraid to tell your therapist that you may be HIV possible. This is as far as the city of Kharkiv is concerned. We all are aware that when a country is a wartime country, we know that basically NGOs will come in handy. That's why I would like to turn to the representatives of the non-governmental organizations. Yaroslava, can we now talk to you? Then Liubov will join in. As an NGO, what are the people you contact? International bodies, international partners, what is the major contribution, internationally speaking? How does it affect the general situation in this country? We are representing a body that propagates the use of fast tests. It has been a routine now. It has not been that way all the time. We are co-working with about 40 public health utilities, and we're also having our own programs for HIV testing. There is a link between the public health utilities and the patients. What do we see? When we talk about the public health protection that Ms. Anastasiia is representing, there is nothing like stigma. You are free to take a test. As for the other types of public health utilities, stigma seems to be a major barrier for people to be tested. We believe that stigma is not enough. But when we talk to our clients or patients, people who contact us through the hotline, they talk about the stigmata. What is interesting here? People who have suffered from stigmatization in Ukraine, they transfer that wound to the countries of the European Union, and they wouldn't go asking for treatment. They know that they are HIV positive. They have moved to the EU countries, but they don't want to be treated. Why? Because they are afraid of being stigmatized. The wound that they have suffered here, they believe that the same applies when they are abroad. So the challenge for these people, or for the people that are internally displaced, they seem to be at a loss. Indeed, the country provides antiviral treatment everywhere, since you have been living in the government-controlled territories. But people are at a loss. They have lost their loved ones. They have lost their home. They have lost their housings. People should be encouraged to take advantage of the services that are available, but they are not taking advantage of that because of these barriers. This is our major task. On the one hand, we are working with the public health protection utilities, with the ones that are directly providing help to HIV positive, as well as we cooperate with other facilities that are whose profile is different. For example, family doctors. I will be open and frank with you. This is not that we have a very good experience. Yes, people turn to them. These institutions are ready to ask for the tests from us, and we give them the tests, and these tests are not being used. We know that. They are just, these test tools are lying there idle. So our task is to encourage them to use. Can a person visit his or her family doctor for a fast test for HIV? Yes, you are entitled to do so. On the one hand, we cannot transfer such a responsibility onto the people. A step must be taken towards the client or the patient on the side of the public health utilities. In the ideal world, a family doctor will be able to identify HIV-positive person through his or her behavior and suggest that a test should be taken, or to identify the symptoms indicating the HIV. You don't have to wait for a person to say, "Can I have please be tested for HIV?" You know, when you are offered a test for other diseases, it should be a routine procedure with no stigma and something of that sort. Liubov, you are working with the underage persons. What are the trends there? this is such a good chamber atmosphere there. Teenergizer is a team that is doing its best, especially concentrating on Ukraine to get rid of the stigmatization for the HIV people. This is the first state to fight. We know that HIV. We know that teenagers are afraid to be tested, and sometimes they're not aware of the danger. There are three areas where we focus as far as the teenagers are concerned about HIV, about the testing and treatment. We have psychological, online testing. We've got students of psychology, people who are students who've been with us on our training, and they consult about 5,000 persons per month. Sometimes people can't afford to have a personal psychologist, so our team will help them to get them in contact with the experienced psychologists. This is the first step for a teenager to know about the testing, about the sexual education in such a safe environment that we call equal to equal, peer to peer. People will know about the aspects of this disease. We also talk to them about contraception means, about AIDS, HIV, and the transfer modes of sexually transmitted diseases. We also talk about LGBT things so that people wouldn't be afraid of coming out, and tell us what they feel like to be treated in a timely manner once they are identified as a risk group. What we also do in 4 countries, including Tajikistan and Kyrgyzstan, we unite teenagers where we support the teenagers living with the HIV from 11 years to 30 years old persons. There are specialists available, and it is safe to share with them your expertise and experiences. This is the place where they can share their challenges and the stigma that they are facing. They share the difficulties of receiving this antiviral treatment. It's quite a challenge for your life, and our team want to make a point that living with HIV is normal. It's okay. You are as human as all the rest of the society are. It should not be stigmatized. And of course, we want to do and to create a safe space for these people with a world without discrimination. We are also launching a yearly project. HAF is helping us there, and we will be running testing, and also will be providing trainings run by our activists. We are dealing with the teenagers of 14 to 16 years old. They will see the presentation when we talk about all these factors, including a help from the United States, where people will receive anonymous HIV tests, and they will know whether they are positive or otherwise. Once they are positive, they will know where to get a high-quality help and not to be stigmatized. I would also like to focus on the following. When you delve into this problematics, you see 2 points. On the one thing, you have to make sure that HIV-positive people are staying in the course of treatment. On the other hand, is early testing for those who are not aware of their status. When we talk about the people who are continuing their treatment, amongst these war times, what do you see? Why people would stop therapy? What are the trends that you can identify in that area? And I'm asking all the panelists. Let me begin. In September and October, we conducted a research at our organization with the help of the different international agencies, and we were asking doctors what, in their opinion, was the cause for stopping the therapy. When people discontinue the therapy, must be initiated by a person, and himself or herself. There might be some objective factor that force people to discontinue the therapy. And according to our research, we have polled 109 doctors in different areas of Ukraine. They have pointed out three things. One is alcohol and narcotics dependency for discontinuation, psychological area and depression. As far as the impact of war, the majority of doctors say that they believe that indeed the war has affected the effect of discontinuation of the therapy. And of course, hostilities, migration, and perhaps migration in itself directly does not seem to affect, or it seems to not to affect. A person has changed his or her place of living. You can also get access to antiretroviral treatment abroad, but because of the sufferings and the traumas of the people, this might be a factor in discontinuation of treatment. As a Center for Public Health, we are tracking down on a quarterly basis the data available and what can be rectified, or how can we affect and encourage people to continue antiviral treatment. We know that this is a lifelong experience. You have to take a medicine, a pill, on the same hour, and this every day in, day out. Of course, we've been tracking the statistics, and we think that migration used to be the factor that made people think about just survival. This data decreased, and by the end of the current year, the indicators for the people who have discontinued treatment are at the level which is equal to the pre-invasion level. So basically, dependency and abuse of drugs seems to be a major factor here. People have to turn to the specialist. They should be aware that daily these pills have to be taken. There are other reasons, I think, including the war, the areas that are close to hostilities. There, the discontinuation level is a little bit higher than elsewhere. But NGOs, our international partners, all of us are trying to rectify the situation, to work with these people, to make sure that they are taking these pills and don't discontinue the therapy. As a practitioner, I would like to say that in my region, the alcohol dependency and abuse of drugs, of course, are diseases in themselves. And whatever you do to explain, you knock on the door of their soul. This special category of patients are very problematic. They change their telephone numbers. They are difficult to find. We don't know where they are. And as my colleague has suggested, such patients were there before the full-scale invasion, and we see them re-emerging. But when they are doing much, much worse, we've seen the worsening of their immune system. And we tell them that were it not that you have not discontinued, you would be doing all right. I would also like to add that we don't have the data in terms of quantity, but we have a tool when we talk about teenagers, for the people until 30 years old. When we talk about the antiviral treatment, What we see a key factor here is the group work. Online group, we see people from different cities in Ukraine or people reaching out to us from abroad. They share their experiences with each other, but because there are questions that they don't know about. As for the ART, for example, we know about different systems, we don't know about different pills, and in that closed group, this is a confidential group, a place where we gather together people who are all HIV positive. They can share information, ask for an advice. Sometimes, when people have missed on a pill on one day, they would ask others what to do next. And early diagnostics. Let us talk about that. Statistics tells us that the majority of those who have identified their status for the first time, it's not only HIV-positive persons. Sometimes they're infected with the AIDS. How critical the situation is here? What are the working tools to stimulate people to know about their status? Indeed, this is another issue that we are facing, and it's been there with us. For example, in 2023-24, half cases, even 60% of those who have been registered for our records, they are at a very late stage of the disease, means that a person has been living with the HIV, he or she has been working, and was not tested for the HIV, meaning that they don't take pills. What are we doing in terms of public health protection? The algorithm of testing has been changed in accordance with the international recommendations by the WHO. We are doing our best to provide, with the help of the donors, a fast testing algorithm for a person. On the day of a first test, we might diagnose the HIV diagnosis and ascribe the means of treatment. Once the doctor has assigned you to be treated, 60% of these people that have been tested over the first weeks in their testing, they are assigned with the way of treatment. This is a very good statistics, even compared with other countries. As I mentioned, 2023-24, 60% of those identified have been living with HIV for a long time. Is there in the late stage of the disease? This is where we need the support of the NGOs, because we are working with the people who are turning to us to addressing the medical facilities. We are also aware of the people who have some symptoms, and no one would force them or encourage them to turn and see the doctor. HIV infection is an infection that is transmitted sexually, as Olga mentioned. 60% or 80% of the cases have been transmitted sexually. We should remember, as far as before the HIV infection, a person might have had some sexually transmitted cases before being infected with HIV. We seem to be a little bit, not a little bit, but we don't have a reliable statistics, to be frank. I will not divulge the reasons for that, but we don't have the statistics on the sexually transmitted diseases. One statistics I found on the USA Statistics Department, there are data concerning the virus as far as the special disease, sexually transmitted disease, only one type of this, and then syphilis seems to be growing. In your presentation, syphilis is another area of the sexually transmitted disease. You see, we don't have only people who are coming to be tested, not only to the specialists in dermatology or other specialists, and all of them must suggest and offer HIV testing, but not always they do this. As for fighting stigmatization during the wartime, and we planned to do this prior to war, but we postponed it. What we did was we set up 2 offices for a free of charge diagnostics and treatment of sexually transmitted diseases, including syphilis. This is absolutely free of charge. One is in Odessa, the other is in Kiev. And people are coming and being served. This is a good entry point to work with them. And for the people who are suffering from the sexually transmitted diseases and are beyond the focal point of the NGOs, these people may hear about this prevention tools. We call it pre-contact prevention. This is the place where, and a point where you can receive the so-called pre-contact prevention. Can I turn to all of you now and to our audiences? If there are people listening to us and they are eager to get tested, where do they go to? Where do they turn to? Perhaps there are people, for these people who want to be tested, privacy and confidentiality matter a lot. What your advice could be here? In the first place, we suggested the family doctor. A family doctor, it's a must for them to have a fast test. If there are indications, a patient can only verbalize his or her idea to be tested. This is the first level of providing treatment. In the infectious clinics, we call them the offices of trust. We have about 400, a little bit south of 400 offices. At the site of the public health protection, there is an interactive map. And while you focus and zoom in on a particular area, you will see specific offices where you can go to. If you live in a certain area, the lion's share of the specialists will know where the specialists are, and this is where you can get tested. This is when it comes down to initiative of a person. But as for the government polyclinics, we have 16 packages, and they have the technical descriptions where HIV testing is included. Every single department in every hospital, either it's a polyclinic, so family member, or a maternity home, they can provide a testing. But as I mentioned, you have to start where I was mentioning. You can also turn to a doctor, of course, family doctor. You have to have an appointment. Once you go to a polyclinics, the other permanent establishment, a hospital, we call also assisted self-testing procedure. These procedures should not be thought of as something which is not good. Social workers have been trained to provide such tests. In Kiev, other ministries have ambulances that are focused on the marginalized layers of population. Outpatients, clinics, we call them. And Anastasiia perhaps might join in here. In Odessa, we have a charity clinic where you can get a HIV test. We've set up such an office. We call it HIV Center, which is basically a place where we treat sexually transmitted diseases. Of course, we have what I have heard was offices of trust, but they are not working on Saturdays, while our centers are available on Saturdays as well. As for my own experiences, all the patients that are willing to be HIV tested have to turn to their therapist or family doctor. But from what I see, people are afraid of the stigma if they are proved to be HIV positive. If you they are testing their blood, sugar in the blood, and I ask them, would you like to be tested for HIV? They tell me, no, I'm just all right. But sometimes when I do other tests, I see syphilis positive patients. Colleagues, if you have questions, you're more than welcome. My name is Stanislava. I represent Suspilnet broadcast. A couple of questions to Yaroslava and Olga. The first one is, have you analyzed the countries that have been going through the war, and what kind of experiences might be taken on board? We have looked into the expertise of these countries. We've called it a meta-analysis, the factors that impact the risks of the sexually transmitted diseases, especially during the wartime. What we saw was we identified 5 factors. One is migration, and a major one. Not a migration per se, but all the circumstances that are relating to it. Second point is the devastated system of health protection. It's not only that it is being destroyed. You see, you might have the walls of the polyclinics, but there are no staff available. Contraception, the condoms, and they're not availability. Fourth point is the increase I know that term in English, which is drug abuse. And the fifth point is violence or forced sexual intercourse. Indeed, in many countries, we have seen the increase of the level of sexually transmitted diseases, including HIV. Now that we are living in a war-torn country, from the point of our capabilities, you see, we still can provide some ways of prevention or treatment. But we are aware of the fact that all wars, with no exclusion, lead to increase of the infectious diseases, including HIV. Another question, have you seen the increase of AIDS patients, and what is the statistics of the newborns with the HIV-positive status? As for the AIDS, this year we have put on record 1,000 and did you ask about the AIDS? The number of AIDS patients and then children. In general, statistics is as follows. It seems to be at the level, at the stable level. As for the identification of the people at what I have called later stages, which means fourth stage, which means AIDS. Since the full-scale invasion, the families with the children are making their best to leave this country. But what we've seen, the birth rate is still here in Ukraine. Luckily enough, women give birth to children, including HIV-positive newborns. According to the WHO statistics, we are below 2%, which is good. As for the 2023, we have officially registered 18 children that have received their HIV from their mothers. As for the blood transfusion, what can we say about the risks, HIV and AIDS here? Before a person wants to be engaged in the donor project of their blood, they are tested for the HIV infection. If this is a permanent donor that we have on our registers, that's one thing. If we have a first-time donor, we preserve his or her blood for 6 months, and only after they have been tested for the second time, their blood or the components of the blood are taken either for transfusion or for other procedures. Officially, we have not had any cases related to blood transfusion. Thank you for this press conference. I would like to ask the panelists on the following. I see eye to eye with you that it's good that self-testing should be available in every place in Ukraine, that the engagement of NGOs together with the government institutions of public health must be providing the testing. But COVID is another issue. The war is yet another factor. We see the stigmatization. We see that people are called up to serve in the armed forces, and we know historical trends, which is to say that any war increases the pace of such things as abuse of drugs or the other kinds of diseases leading to HIV or AIDS. I would like to address the panel in general. What can government do to simplify the access to the to fighting these diseases in the ranks of the Ukrainian armed forces, including antiretroviral treatments? We know that in 2023, the legislation has been changed as far as the draft is concerned. For example, HIV-positive can be called up to the Ukrainian army. So I would be glad to hear your take on this. You see, according to the order of the Ministry of Public Health, the changes have been introduced into the law after you have gone through the medical commission at the recruiting office. If you are found HIV positive, you are released from service. If from 2 to 250, 100 is your level of HIV, you are conditionally mobilized. If you are HIV-free, you can serve in the armed forces. As for the antiviral therapy, according to our algorithms, are administered only at the public health protection centers, which is to say at the nearest hospital or the place of the antiviral therapy. Doctors can and are providing long-term treatment. That is to say, people can get enough resources for 3, 6 to 12-month 12-month period treatment. You see, you can't. It's not always useful to carry with you that many bottles with these tools. As for the testing, currently we don't have with us the representatives of the Ministry of Defense to lay down their vision. The facilities that are working with the Ministry of Health Protection those who are going through the military health commission must be tested for HIV. Another question that we have, the last one, it seems.
Pretty much similar to yours. If anyone has any other information on sort of the state of infection and prevention and then medication within the armed forces, because we spoke a lot about civilians' capacities to go to clinics, etc., but for them, for soldiers who may not have the possibility to go to these clinics, do you have any means to monitor, prevent, and medicate on the front line?
Ви почули питання, хто візьметься? Чи є у нас зараз засоби, які допомагають нашим військовим на фронті для того?
Have you heard the question at the front line? What can we do to provide the therapies at the front? You see, we don't have people from the MOD here. What I can say is this. Yes, positive, they can be treated, but I think, and I have to admit that this is a major problem, which is to say, provide treatment for those who are at the front line. Yes, you can give them means for as long as 6 months, but you can't imagine the conditions we're living in. We can have an idea. You've seen the war movies, but we can't really imagine the environment they're living in. And perhaps it's not always possible for them or remember to take a pill at the same time every day, even if a person is willing to do so. Not always is it possible, only because you're being shelled by the enemy, you're being fired at. And I agree that this is a major factor. We should not turn away for this or pay lip service to it. We can't say that, yes, we've done everything that can be done. Here is the pills that you will use for 6 months to go. Reality is different. I don't want to share with you some specifics. We participated last year in the so-called Blood Forum, and there were representatives from our armed forces, and they would answer, yes, evacuation is available, 3 hours is available officially, but in practice, it's not always possible to do. You see, when you are being bombed and you are being shelled, not when you have been evacuated from the front line, you've got time to think or to change your dress, uniform. So you are raising a very important point. It should be looked into. And this is the area where we are self-complacent, where we could say that we've done what we have done and we have reached very positive level of living up to all the instructions.
Mostly medication. What about prevention and testing? I'm guessing it's an issue too.
Can you repeat that question again, please? I mentioned that the MOD doesn't have the antiretroviral pills at their disposal. Even when people are in the ranks of the armed forces, they have to go through the official hospitals. As for the changes that we can think of, given the large scale of immigration, it's difficult to foresee any changes. We have to wrap up here. We know how relevant and important it is. I would like to thank all the panelists and those who have joined in. And I appreciate those people who are fighting this disease. And of course, my thanks go to our defense forces and the forces and the Ukrainian armed forces, because it's due to their effort that we can sit here and talk about HIV fighting. We will meet in 5 minutes' time. At the next briefing, we will talk about the campaign public awareness campaign that you have to have some glow on your clothes. Stay tuned. We are working towards the Ukrainian victory. Glory to Ukraine.